What's up, everyone? I am Dr. Pedigo. I'm a sports chiropractor in Southern Illinois. This is my very first live Q&A, completely unedited, completely raw. So I'm sure I'm going to make a few mistakes as I go through all of your questions. But if you do not follow me on Instagram, I highly recommend, because that's where I do most of my Q&A and gather all my information to transfer it here to a live video. My Instagram handle is at si.athlete.chiropractor. So I'm going to go ahead and get started. I'm going to try not to make these too long, but I also want to be very detailed to give you a lot of information. Now, all of this stuff is based strictly off my expertise, my clinical experience, my own research, my own studying of current medical research and everything like that. So please, this is supposed to be very educational and not strictly like to give you medical advice or anything like that. And actually, if you're dealing with any of the things I'm talking about, please get evaluated by a medical professional. And if you want that to be me, even if you're not local to my clinic, I have people travel from other states to see me. I have something I've developed called an intensive rehab care program that people will actually travel to me and undergo within 1 to 2 weeks. So again, don't be afraid to reach out to me. All right, here we go. First question. I want to get an MRI before I do anything. Okay, so when we're making medical decisions, or helping a patient make medical decisions, because it is not a one-way street. I know a lot of doctors out there are very headstrong, and what they say is what goes kind of thing, but actually we need to get the patient involved in the decision making, because evidence-based care is a three-legged stool. It's based on patient preference, what the patient wants, current research or medical guidelines, and then the doctor's experience. So we actually, when we make a medical decision, we need to take all three of those factors into consideration. So you want an MRI. Okay. Well, first I need to find out why you want an MRI and your reasoning, because if it's something that I don't feel correlates with where we need to go clinically, then, I can share that information with you and we can see if, it actually is the best course of action for you. But most medical research now, if you come into my office with any type of pain, I need to make sure there's nothing scary going on. No red flags is what we call it. Nothing emergent or something that's going to turn into an emergency. In the absence of that being present, then imaging is not always warranted initially, especially an MRI. Because most of the time, if you're going to use an MRI, it has to be cleared by the insurance anyways, because they're expensive out of the pocket. And insurance companies are not going to just go ahead and give you an MRI without getting it, most of the time, without getting an x-ray first, or at least being evaluated and undergoing some kind of trial of care, chiropractic, physical therapy, whatever it may be. So MRIs are not always the easiest thing to get approved. So if you're going through the process of getting an MRI approved, then you're wasting a lot of recovery time, because the sooner you start getting on top of a pain, ache, injury, the better the outcomes are going to be long term, instead of just like waiting. The sooner the better to get treatment. So if you want the MRI, we have to make sure it makes clinical sense, and we're not just wasting money or chasing something like that for no reason at all. Question number 2. Why do I hurt more now that I'm 30? So this is a loaded question, and I'm going to keep it very basic, but very, very important. So my answer to this is basic, but it's extremely important. And most likely the reason why is because your physical activity level is nowhere near where it was when you were 20. Maybe even the job you have now at the age of 30 requires you to be sedentary and sit a lot or travel a lot, and you're just not moving and using your joints. Our bodies are not made to sit. Our bodies are made to move, be challenged, be stressed, undergo vigorous exercise. And let's face it, today in our world, we don't do that most of the time. and 60 to 70% of adults don't even get the recommended amount of exercise, which is not a lot at all. I don't have the stats off the top of my head, but it might be like 30 to 40 minutes of like walking and jogging at least. Like, it's nothing at all, and 60 to 70% of people don't even get it. So my guess is at the age of 30, you're very much not as active as you were. Maybe you have more stressors in your life, financially, physically, mentally, emotionally, which actually impacts pain. And then maybe your diet's gotten worse because life gets busier typically the older you get. You know, people get married, have kids, get promotions, you know, things that can add a lot of stress to life, which puts your physical, mental, and emotional health on the back burner, unfortunately, even though we don't want that to happen. We want you to stay proactive. So those are some reasons why. Question number 3. Why do you give exercises? Okay, so this is also a very, very good and loaded question. But for the sake of our conversation, I'm going to leave it to this. Adjustments, things of that nature are amazing pain relievers. However, they truly need to be coupled with exercises, because if we're adjusting a painful joint or a joint that's not moving well, and we do that, and then you go right back into your old habits of sitting, you know, your job requires you to sit 8 hours a day, or your job requires you to travel, and you don't do anything outside of the clinic. So I see you a few times here and adjust you, and you just go back to your old movement habits and do nothing to keep the joint moving, keep it stimulated, keep your body in a good position. Then, you know, we're just going to keep taking 3 steps forward, 4 steps back. So we give exercises to help you maintain those ranges of motion, maintain that joint health, and really try to encourage you to be more active. Because like I said, most people are not very active, or at least close to as active as they need to be or is recommended. So exercises are a good way to help people become self-sufficient, where you need me less, teach you good habits, and just get you to an overall better place physically. Question number 4. My MD took an MRI and said I have disc bulges. Should I wait to start your intensive rehab plan, or should I do it immediately? Immediately is always my answer. If you hurt or have an injury or something like that, sooner the better always. Because what happens is people take time off, they rest, and they're going to start to feel better. It's because they're not doing the stuff that they were doing before. So as soon as they start to feel better and they go back to their habits or their activities that were causing the pain, it's going to come back, because it was never rehabbed correctly. It was the body was never retrained, re-strengthened. All these other factors were not taken care of. You were just simply unloading the area of the body that hurt till it calmed down and got out of the inflammatory state. And then as soon as you go back into those old habits, here it comes again. That's why some people say, I've had back pain for 20 years, but it only happens once or twice a year. Well, there's a reason why it's happening once or twice a year, because it's never fully addressed. The root cause, what was actually causing the issue, was not addressed. It was all symptom relief. If you chase symptoms, pain is a symptom. It is not a diagnosis. Pain is present because of something underlying, a deeper issue. If you just ice, heat, rest, stretch, things like that, all that is just symptom relief. So things are going to continue to come back and get angry if you do not start getting to the root cause, or finding a provider that's going to help you get to the root cause instead of masking all the symptoms. So sooner the better on any type of treatment, because you're going to get ahead of the game, and you're not going to be playing catch up by waiting 2 years and realize, okay, well, I'm sick of hurting for 2 years. I'm going to finally do something. You can still get a lot better if you wait, but why wait when maybe in those 2 years you weren't able to lift weights like you wanted to. You weren't able to travel because you couldn't even sit in the car or on the plane or whatever. Like, why live in pain when you don't have to? Question number 5, and there's only 6 questions this time, so we're not going much longer. But question number 5, why am I sore after I get my lower back adjusted from other chiropractors? So, There are several reasons, and I'll just give you some basic ones. Number one is the timing of the adjustment. So if someone, like within the past 2 days, severely strains their low back or has like a very nasty disc herniation, and they're very acute and inflamed and irritated, sometimes they don't respond well to a chiropractor just throwing them on their side and jumping on top of them and adjusting them. And that's, might be a little uncomfortable. And again, some people respond great to that. Everyone's different. So this is not a general statement. I'm just throwing some ideas out there. So maybe you're just like really inflamed and irritated because of how new the injury is. So you're sore. And soreness is not always a bad thing. If we make your body move the way it needs to do to make it less sensitive and regain your range of motion, you're probably going to get sore. That's okay. Or it might be the type of technique they use. There's more aggressive techniques and there's very gentle and light techniques. It could depend on the type of technique the chiropractor is using. All those things. Again, soreness is, kind of expected for people in acute pain after being treated. But if it's like excessive or like you're really not sure why you're hurting that bad after being treated, then you probably need to bring that to your provider's attention so you can both reevaluate like what you're doing at that time of when you're hurting. And maybe the treatment plan needs to be altered just slightly. All right, last question. History of sciatica off and on for 5 years. How can your approach help me? Like I said 2 questions ago, if it's still going on and off like that, your root cause was never addressed. So if you have true sciatica, the root cause can be fixed where this isn't happening on and off. So whatever you were doing or whoever was treating you for those 5 years were just helping you get symptom relief. Now, it's not always the provider's fault. A lot of times it's the patient's fault too, because patients like to take shortcuts sometimes. That's okay. We live in a busy world. Not everyone has time for, things. I understand that. However, when it comes to this, you need to make time and make it a priority. So if you just go till you're out of pain to the chiropractor and you don't finish your rehab plan, that's pretty much on you because you didn't follow through with the medical advice and you didn't follow through with the full rehab plan. Pain is the first thing to go. So pain is very easy to manipulate. You come in hurting, I can make you feel pretty good really fast in a short amount of time. However, that's not our priority. Our priority is keeping that pain away for a long time, keeping it away where you can do things you love without hurting. That's the plan. So just because you're out of pain does not mean your recovery process is done or your treatment plan is completed. So if you quit your treatment plan early and you continue to have these injuries or you don't actually commit to a real plan, then that's on you, not the provider. Now, let me flip that coin back to the provider. There are providers that will just treat your symptoms and not really get to the root cause. That is out there as well. So if you're in this situation, you need to look at one or two things. Did I fully commit to a real plan that I knew was the root cause and a trusted provider that could help me get better? If I did, then it's not on me. It's probably on the treatment plan. If I didn't, if I quit going or I rescheduled my appointment 10 times or I took a lot of time off in between appointments and I didn't do my exercises at home, then that's probably on you. So you need to see, was it your fault or was it the provider's fault? Here's the deal. At the end of the day, that doesn't matter. What matters is you making that realization that something's not right and the root cause was not addressed, and then you go back and find someone who's going to help you get to the root cause of the issue. So there was 6 questions in about 15 minutes. So I look forward to continuing to do this. Please, again, if you want a specific question answered, you have to follow me on Instagram. You have to either send me a message or wait for me to upload the Q&A to my Instagram story and post your question there. I have some big things coming out. I have an online platform coming out soon in the next couple of months where you can buy a membership to that. People who become members and invest in my platform get premium service and premium outcomes, and they get all the attention and detail because they're committing to something I'm providing. This takes a lot of work. So I greatly appreciate you sharing this and supporting it, and I look forward to continuing. Thanks, guys.